Hi, everybody. I'm Pete Christensen,
I'm Coffee Brown.
and welcome to episode 25 of Don't Die Dumb. I want to start today by talking about the Jupiter Project in New Mexico. And we know this goes out nationally, internationally. I can tell that by the people that follow it. But I think this is important for anybody because these projects, it's an AI project, are happening around the United States, and you might want to know about them. Now, the Jupiter Project,
According to the ads, it's going to bring ecology and thousands of jobs and clean water to
to a desert area, to Doña County. And they're running these ads all the time. The truth is, it's going to bring 750 jobs.
Temporarily.
No, 2,000 to build it, 750 supposedly permanent. But
How big of an impact is that in that community?
well, here's the problem. Doña Ana has an operating budget of $20 million a year. That's for the whole county, okay, not just the city, the whole county down there to run it. And we were talking off camera last week that they went into an emergency council, and then they went into closed council and approved a budget of $165 million. That's wrong.
Eight times their actual budget.
It's $165 billion. They can't get that money.
Oh, billion.
$165 billion for this. They have no way to get that money. Now, equally important is the damage that it might do. Now, for water consumption, and this is an area where they go by, I'm going to check my notes to make sure I have this right. The validation alliance method, that's what they call it, where they have their water. This has been prone over and over and over again to adding to not getting clean water. They've had cyanide in their water. I don't know how many times in the past. They've got a terrible track record. Now also, it's going to create 750 million tons, 13 million tons of greenhouse gases, not 750, 13 million tons of greenhouse gases, and also some 75 million tons, possibly, of formaldehyde. And this is all for a project that is an AI project that creates a ton of pollution, besides these other pollution, and uses up water. But they're under the
But New Mexico has tons of water, right? I mean,
No.
We're a water-rich country, right? Like Michigan, like the land of 10,000 lakes.
Now remember this, they got this done because they're under the amount of water, maximum water usage. But they got that done because they've split the facility in half. Each one is under. It's all one big facility.
But combined, they're over.
It's way, way over the top. The Jupiter Project might work well in certain areas, but here, you're looking at a disastrous project, in my opinion.
Well, first of all, you're worried about greenhouse gases. Don't be. Climate change is a hoax. By the way, speaking of weather, did you know this is the hottest summer ever for the Southwest? And going to be one of the most prolonged heat waves.
Yeah.
Again, just like each of the last 30 years. But luckily, climate change itself is a hoax. It's the Chinese that are cooking the Southwest part of America.
And that drifts over.
Well, actually, 80% of the continental United States.
Yeah. China and America are the biggest polluters in the world.
Well, but that's not causing greenhouse gases.
No,
it's a Chinese hoax. They're just tricking all our thermometers into reading 110.
Ask the people.
Which I think is brilliant. And they make it feel like 110. Like, I don't know about you, but when the thermometer says it's hot out, it actually feels hot out to me. Mm-hmm. And when they say, wow, this is the hottest year ever, like they have for the last 30 years in a row, I'm thinking, it does feel hotter to me. And yet the whole thing is a hoax. Isn't that awesome? I wonder how the Chinese are doing that.
People want to believe it's a hoax. The president said it was a hoax. Rich people want to make you believe it's a hoax so they can make money off it.
Right.
Poor people want to believe it's a hoax because it's
Because they're fucked otherwise.
because
Sorry for the language.
because it's too distressing to face
Right.
head on.
We look away from stuff that's so big we can't face it. So there's the greenhouse gases, there's the formaldehyde, there's the fact that in a desert state, in the driest state in the Union, they're using all these millions of tons of water, right? And then there's the questionableness of how many AI centers do we need at all. We already have one for sure, Grok, which is designed to present a skewed worldview, which is designed not to be objective. But we also have another one, which is the one I use, OpenAI, which is now operating autonomous killer drones for the Pentagon and spying on the entire American public. So while there are some potential really good things about AI, we don't necessarily need to be in the AI gold rush that we're in. And in fact, even insiders are talking about this being a bubble.
And the other thing to remember is, I'll say this, and if they think I'm lying, they can sue me. This county has no way to pay $165 billion.
Well, that's clear where that's going to come from. They're going to get tax breaks, and they're going to have promises of low wages. Now, I had this conversation with a former mayor of Albuquerque. This guy was so proud because he was going to bring in all these jobs. And the way that he was doing it was by pointing out to them that we have the worst wages in the country. That's not actually quite true, but it's pretty close. We're always in the bottom 5. And
we can't give you slave labor, but we can get real close
real
to
close.
it. Yeah.
And that we were given these gigantic tax breaks. And I said, well, in that case, Mr. Mayor, what does industry bring to the state? Well, it brings employment. I said, yeah, but terrible employment. How does it benefit the state? Well, taxes and wages. I said, great. We're on the same page. But if you give away the taxes and wages, now what does it bring to the state other than that it uses the bulk of our water? And he was like, yeah, but taxes and wages. And I go, yeah, but you can't get them if you bargain by giving them away. To get the taxes and wages, you have to actually get the taxes and wages. We talk all the time about how growth in GDP is good for the country, but that only works if it's more or less distributed across the income brackets. Ever since Reagan, a rising tide has only floated all yachts. The middle class has been shrinking steadily since 1970.
Now, I'd like you to get more information on this. Don't take my word for it. You can get exact information from the Sierra Club or the Environmental Justice Caucus of the Democratic Party. Check them out. They make no money off this. They have nothing to gain and everything to lose by bad publicity if they're wrong.
Well,
so check them out.
I'm going to point out an obvious problem with that, which is that the Sierra Club and NPR are seen as liberal bastions because apparently taking care of the planet is something only a libtard would do. Well, hang on. But you can check their sources. Where are they getting their information from? So whenever you go to one of these places, and this, whether you're a Fox News person or an NPR person, follow the information back to find out what the actual sources are. It's pretty easy to do. Remember last time we talked about people saying, well, we don't know what's in vaccines. Yes, we do. It takes less than a minute to answer that question for any vaccine you're interested in. So don't go to NPR and Sierra Club and go, well, if they say it, it must be true. Go to them and look at their sources and say, what do I think about these sources? Until recently, we had NOAA, the National Oceanic and Atmosphere Association. Now that's been gutted because NOAA kept reporting on climate disasters. It exists, but in a hollowed out form. And until recently, we were all falling for this hoax. Just because it got hotter every year, we thought there was climate change. But now we've gotten rid of the agency that monitors climate. So when you look at sources, you've got to be really, really careful that they're not politicized, either left or right. If they're politicized in a direction you like, that doesn't make them better sources. It makes them worse because you'll fall for them more easily. It's super important to critique the things you're inclined to believe.
So my question to you is, Phoenix, Arizona has created a heat generator of a city through the use of blacktop and concrete. And climatologists are saying it might be unlivable in the future also because they've drained 1/4 of the aquifer in 150 years, and now they've claimed drained another quarter of it in 50 years, and now there's 3 million people in the greater Phoenix area. So climatologists are saying it might not be livable. Is Albuquerque headed in that same direction?
Climatologists, what do they know? I got vibes, man. I go with my gut. My gut says we'll have infinite water even when there are billions of people in New Mexico. My gut says that problem will just magically solve itself. It'll be all right. It'll be okay because technology will always solve the problems technology causes.
It's hard to face our problems. And that's why Democrats get a bad rap. They say, I hear all the time, Democrats hate everything. No, they acknowledge things that they want to change.
Actually, I did some homework on this. So
Yes.
Pete wanted me to think about the notion that, we got a comment from a viewer. And by the way, thank you for these comments. Please keep sending us comments. And especially if you think we've made a mistake on something, tell us what you think the mistake was and where you think we should look for a better answer. And we'll do homework on that. We'll do some corrections episodes. Given the number of topics we talk about, we're going to make mistakes. So help us stay honest. All right. But anyway, back to this. So the perception that progressives just only ever see the world in terms of things they complain about. And there is some truth to that. For one thing, the woke, when I use the word woke, I'm referring to communication style, not a set of values. The right uses woke to mean anything they just don't like, anything that makes them uncomfortable. That's way too broad. But the kind of finger-waving, scolding approach, which I've heard from me sometimes, that's what I mean by woke. And yeah, that's a pretty snippy, crabby, complaining sort of a style. And I do agree that progressives are unwilling to acknowledge good things about America. But the far right is unwilling to acknowledge errors of America. And I think a grown-up would say, here are some things we do right, and here are some things we do badly. We do have a history of having taken over this continent through slavery and genocide. And much of the bulk of that genocide actually wasn't with guns, though we did our best. Most of it was because we brought so much smallpox and syphilis and other Western European diseases. Why were we so tough about those diseases and the Native Americans died? Because Western Europeans didn't believe in bathing or hygiene, and Native Americans did. And so their immune systems weren't ready for the sort of cesspool that we brought with us. So yes, Democrats, I think, do tend to focus on the negatives of America. And the right tends to focus on the positives, but both of those are broken focuses. And the positives are to a large extent mythical. The settlers weren't heroic because they came here and killed a bunch of Native Americans. They were oppressors who came and stole land and conquered a country that wasn't theirs and then felt proud about it afterward. Scalping started as something that Western Europeans were paying bounties for Native American scalps. It's not something Native Americans started. We associate it now with Native Americans, but it was a Western European thing. It was a conquistador thing.
Now, the subject of our history has come to fruition in this way. The administration now is taking down any signs that are derogatory, that they feel are derogatory toward America. References to slavery, to Native American genocide, to internment camps for the Japanese. They're taking all these. I think that's a bad move. I think we have to realize the things that we've done wrong in the past, because then we won't do them again. It's the old history lesson. If you don't know your history, you're bound to repeat it.
If our history were all good, we wouldn't have to censor it. And nobody's history is all good. If somebody tells you your country has always been a paragon of virtue and never done anything wrong, it doesn't matter which country we're talking about. You know that's a false statement. Nobody has a track record like that. But if we acknowledge errors of the past and try to be better than that in the future, that's actually what progressives would like. Now, progressives also see the right as only ever complaining about shit. And the reason is when they talk to each other, they only talk to each other about what they disapprove of. So one of the things I wanted to talk about today was maybe it's time to have a national conversation about what are some values we can coalesce around. For example, everybody I know of agrees that one of the roles of government is to stabilize money or to enforce contracts or to prevent violent crime. Interestingly, one of the ones we appear not to agree on between the right and the left is that the left doesn't like white-collar crime, and the right thinks it's fine as long as you pay politicians enough money, you can commit all the white-collar crime you want. The right tends to be supported by billionaires, and that's who's committing the white-collar crime. Blue-collar crime is scary. I mean, Mike Tyson used to mug people. I don't want to run into Mike Tyson in a dark alley. That's a scarier thing to visualize than some accountant moving stuff around in columns and double booking so as to hide millions of dollars. Well, let's say somebody with 35 felony convictions for fraud, somebody like that. That's not bothersome. But a mugger, though in their lifetime they may only ever get a few $1,000s, is scary. And white-collar crime, though it can wipe out pensions for thousands of elderly people and wipe out benefits for thousands of working people, but it doesn't involve direct hands-on violence, and so we see it as lesser. So my point is, send us your ideas about things that as a country we should agree on. Do we actually want to say everybody has to be the same religion, the same color? Do we actually want to say all women need to have the same role and need to interact with men in the same way? Or are those things that maybe are less universal than all that?
Now, I want to talk about universal health care next. Universal health care, the way the layman understands, the way I understand it, is everybody gets Medicare and Medicaid. Is that not right?
It's one way it could work.
And the argument I always hear against it is the country will go broke, you can't afford it. You'll drive the country into a depression.
Now, fascinatingly, there's a very good chance we would save money if we had universal health care. And I know that's counterintuitive, but let me flesh out this argument before you decide that I've completely lost it, even though I have been drinking heavily all morning and Pete brought over some hash. And
Don't even kid around about that.
No, neither of us does any of that stuff. But the point is, this does sound whack when I say it could save us money, but let me finish this thought. So there are a whole bunch of problems with the American healthcare system, but the most fundamental, and remember, I'm a retired physician, and I believe in healthcare. I love medicine. I absolutely love medicine. Big, wet, sloppy kiss, love medicine. But our system, unlike any other in the industrialized world, is designed to deliver you to billers. It is not designed to deliver health care to you. Just like TV isn't there to entertain you, it's there to bring you to advertisers. Entertainment is just the bait they leave under the box trap. In the same way, our healthcare system delivers as much healthcare as it thinks it needs to maintain credibility, but where it makes its money is in denying care, especially under capitated care. Now, would there be limits? Would there be rationing if we had universal health care? And the answer is yes, there would. There's rationing now based on how rich you are, and there would be rationing then based on how much we put into the pot. But let me make a case why that could be cheaper rather than more expensive. First, I've been doing some online work with AI, crunching some numbers, and essentially the average American now would pay higher taxes, but they wouldn't have health care premiums, they wouldn't have deductibles, they wouldn't have out-of-pocket expenses, maybe copays. And the net effect would be that most of us would save on average around $5,000 a year. Now, these are estimates, and a lot would depend on how we actually operationalize it. But your personal household income on average could increase by $5,000 a year. Okay? But also, healthcare would be more coordinated. Right now, you can't go out of system and things like that. If you go on a trip to visit your mom in Kansas and you get sick while you're there, you may wind up footing the entire bill. But in a national healthcare system, not only would you still be covered when you go and visit your mom, but your records would be available. Hospital records right now are kept on private computer systems. By that I mean they're corporate, but they're owned privately, not by the government. And the data is proprietary. So getting data from one system to another is difficult, and it generates bills. You have to pay to get your own data delivered while you're in the emergency room in Kansas, and it may not get there in a timely fashion, and you'll still get the bill even if the information gets there after you've come home to your own system. And God help you if you get hospitalized. The one thing we used to kind of have going for that system was that, well, at least the records are private. The government doesn't have access to our systems. But this administration has accessed all of the medical records in the country on the pretext of looking for fraud. They're actually looking for immigrants. But while they're at it, they're also finding dissidents. That's people like me and Pete who are actually critical of some of what we see. So the privacy thing is already gone. Just forget it. That ship has sailed. You do not have any medical record privacy anymore. The people you would like to hide it from are the only ones who have access. The people who don't have access to it are the people around you who might try to help you out. So that would help. By coordinating the care and by not having these disconnects between systems, we would save a bucket of money and the system would work more effectively. By cutting out the insurers, by cutting out the private insurers, we would gain back more than we would lose because their job is to deny care in order to feed their shareholders. But a public healthcare system doesn't have shareholders that you, the patient, would be paying a tithe to. So a well-run, clearly not our current administration, but a well-run public healthcare system likely would save us much more than it would cost. Also, all the public healthcare systems I'm aware of focus on primary care. That's preventive and maintenance care. And that is where the big payoff is. We're all going to get old and sick and die, except for me. And that's going to happen. But if we can delay that, if people work longer, they put more into the tax base, they live better, happier, more productive lives. If you don't get sick until you're 60 or 70 or older, then that's a win, even though you will eventually get sick enough to need higher end care. So primary and maintenance care have always been more cost effective. Every medical economist will back this up. And again, go check my facts. All these things I'm saying that you're going, I wonder if that's true. That's exactly what you should say. Go check, find out if it's true.
This to me is reminiscent of the AIDS crisis. For years, insurance companies wouldn't give a partner, you're not married but you have a partner, they wouldn't give them coverage. And when I talked to an insurance executive, I had a TV show in Flagstaff for years, and I interviewed. He said, let me be frank with you. And he said this off camera. He wouldn't say it on camera.
And his name was Ernest, but he wanted to be frank. So he's kind of frank and earnest.
I'm making a point here.
Okay.
He said, we don't want to give insurance, life insurance, to partners because of the gay community, because AIDS has a 7-year incubation period, so we can't tell if we're going to have to pay it off or not. This smacks of that same type of underlying greed that people faced in that time as well. As it turns out, they now give insurance to partners, and it's been no big loss, you know.
Well, the antiretrovirals have helped a lot with that. But
yeah, of course.
People have an assumption we'll always come up with a fix for everything, and that's not true at all. Now, I want to say this. I was in medical school when AIDS was so new nobody could remember what AIDS stood for. We didn't actually know yet that it was a virus. Everybody presumed it would be, but we hadn't proved it yet. And in my class of 100, about 80% of them were comfortable saying out loud, well, I'm not going to treat those patients. Why should I risk my life for fags and drug abusers? I've heard that language in an actual classroom. And by the way, my professors were horrified, as was the other 20% of the class. But here's the problem. Even if that makes sense to you, maybe you're sitting there going, yeah, why should I pay tax dollars for queers and for drug abusers? The notion that they somehow are a separate population is a false notion. And because we didn't jump on AIDS at the beginning, it spread into the heterosexual community, into the non-drug abusing community. People lied when they gave plasma. In France, for a while, they were intentionally giving AIDS-infected blood, HIV-infected blood, to hemophiliacs because they would die and they were costing France's public healthcare system a significant amount of money.
Seriously.
I'm dead serious. This is
Wow.
actually a historical event. So the notion that you can ignore a group you don't like, their problems aren't your problems, that is a stupid notion that always backfires. In this country, right-wing Jews supported MAGA, and now they're freaked out because MAGA is anti-Semitic. We're actually working with Israel against Iran at the same time as our top public figures are endorsing anti-Semitism. And, to be fair, anti-Islam. They're just basically anti-anybody who's not themselves. And the net effect is that the people who thought they had allies, those allies are turning on them. You're thinking, well, I'm not one of the outgroups. I'm not gay. I'm a Christian. I'm white. I'm male. I'll be okay. Nope. Sooner or later, you're going to disagree with this administration. Look how they've treated every single person who has ever disagreed with them, including the old white men and the perky blonde women in this administration. They all get thrown under the bus the second they disagree with something. And that will be you. I guarantee you, if you think it's okay for the government to take sides, you are going to be on the wrong side in the future.
Don't forget, sooner or later, they come for the poor people. And right now, the poor people are all the people that used to think they were in the middle class. So we've all got a target on our backs sooner or later. I want to talk, we touched about this before, but I want to talk about the prefrontal cortex. It's mature at 25. When does it work the best? And how many years have I been past that?
So there is a notion that as we get older, we experience cognitive decline. On average, that's true, but people are individuals. So generally around 65 is when you begin to see a noticeable uptick in slowing of mental functions and things like that. So based on that, I would say our prefrontal cortex, the back end of it, I don't have objective data on like we do for the front end. We know pretty much that it closes up by around 25, which is much later than most of us thought. We don't really know exactly when it deteriorates, but we do know that cognitive function statistically begins to decline at around 65. Now, 10% of people who are over 100 have no cognitive decline. They're superagers. So I'm not telling you that you will suffer cognitive decline at 65, but if you're saying where's the sweet spot for the prefrontal cortex, I'm going to say 25 to 65, a 40-year span.
Okay, very good. Now, I'm going to save this subject for another time, but we had a letter asking, is there anything you can do to slow down old age? Let's not talk about that now. We'll talk about that
We'll
another
build a whole
show.
show around it. That's actually a really, really good topic.
Yeah, I think so too.
Spoiler alert, some things, somewhat.
Very quickly in the 4 minutes we have left, and we touched on this before, they're now saying that diabetes may be a factor in dementia. Is that correct?
The bulk of dementia is caused by poor blood flow in the brain and by the accumulation of
Amyloid plaques, correct?
well, that's specifically for Alzheimer's.
Alzheimer's.
But accumulation of waste products and cell debris and things
Okay,
like that.
so before what's the difference between Alzheimer's and dementia?
Alzheimer's is one kind of dementia, but there are multiple kinds of dementia. And even Alzheimer's seems to be associated with vascular disease.
Okay, yeah.
So this, of course, segues a little bit into our next week's topic, but essentially, the best hedge against both dementia and dying early are to take care of your vascular system. So the bulk of what we're going to talk about is going to be ways to keep your vascular system healthy. And it turns out that the things you do to protect your heart and longevity are the same things that protect your brain and your cognitive longevity, which I think is far more important.
Well, here's the problem. Okay, I consider myself somewhat normal. I'm doing all, okay, I said myself, I didn't say other people consider me normal. I'm doing all cardiovascular exercise right now, and I feel great, but I'm not doing resistance. I'm not doing anything for the arms or the chest or the stomach. So I look like hell. Our own ego, we want to look good.
We'll start with resistance training in the very next episode because that actually turns out to be highly relevant.
Okay, well, that's our time for today. Hope you enjoyed the show. Don't be afraid to give us questions or comments. I'm Pete Christensen.
I'm Coffee Brown.
And remember,
Don't die dumb.